Good morning students. Today in this video you're going to see about the blood supply of the brain. So for the brain, blood supply is very important, and if there is reduced blood supply to the brain, what happens? It leads to a very important clinical condition known as stroke. So knowing the anatomy of the arterial supply of the brain is very important. Let's move into the anatomy of it. So these are the important 5-mark questions from this topic. So in the blood supply of brain, blood supply includes both arterial supply and the venous drainage. So here we are going to see in this video only the arterial supply. The venous drainage will be dealt in the next video. Okay. So what are the arteries which supplies the brain? So there are 4 main arteries, 2 vertebral arteries and 2 internal carotid arteries. So we call it as the vertebral system and the carotid system, which is going to supply the brain. Now we are going to see about the vertebral artery. So from where this vertebral artery arises, its origin, its course and its branches. So in this picture you can make out the brachiocephalic trunk. This brachiocephalic trunk divides into subclavian artery and the common carotid artery. So coming to the subclavian artery, it has got 3 parts. So from the first part of the subclavian artery, you can see an artery which ascends upwards and goes backwards and enters into the foramina transversorium. Yes, I'll come back. So this artery is the vertebral artery. So this artery arises from the first part of the subclavian artery. It runs upwards and backwards and medially towards a foramina known as foramina transversorium, which is present in the cervical vertebra. So it is present in all cervical vertebrae. So it enters into the foramen transversorium of the cervical vertebrae, travels through the foramen in all the cervical vertebrae. Then what happens? It comes out of the foramen transversorium and winds around the first cervical vertebra. We call it as atlas. Winds around the atlas, then goes medially and enters into the cranial cavity through foramen magnum, which is present in the skull. So in the skull there is a very big foramen, that is foramen magnum. So through the foramen magnum it enters into the cranial cavity. Okay, then what happens? After entering into the cranial cavity, in front of the brain stem structures, it joins with the fellow vertebral artery, the opposite vertebral artery, and unites to form an artery known as basilar artery. Okay. So this is about the vertebral artery. So the vertebral artery terminates by uniting with the opposite vertebral artery to form the basilar artery. So this is about the origin and the course and the termination of the vertebral artery. So you know the vertebral artery is a branch from the first part of the subclavian artery. It ascends upwards and backwards and medially. Then it enters into the foramen transversorium, which is present within the cervical vertebrae. So in this picture you can have taken this picture to show the cervical vertebra with the foramen transversorium. This is the identification feature of the cervical vertebra. Okay, you can make out the foramen transversorium. So this vertebral artery travels through these foramen and comes out of the foramen transversorium of the atlas, then winds around the body of the atlas, then it joins with the fellow vertebral artery of the opposite side and unites to form a basilar. Now we are going to see about the branches of the vertebral artery. So till now we have seen its origin, course and termination. Now we are moving on to its branches. So coming to the branches. So in this picture, you can make out the vertebral artery. Yes. So from the vertebral artery, you can see two arteries arises, right and left. Is the two arteries are known as anterior spinal artery. So these two arteries unite to form the single anterior spinal artery. So this supplies the spinal cord. The anterior spinal artery supplies the spinal cord, and the next is the posterior spinal artery. You can make out it is also arising from the vertebral artery on either sides that descends down, okay, and supplies the spinal cord. Posterior spinal artery and the anterior spinal artery. There is one anterior spinal artery and two posterior spinal artery. Okay. The next branch is the pica, that is posterior inferior cerebellar artery. You can make out, yes. So this is the pica, posterior inferior cerebellar artery, which is the largest branch of the vertebral artery. So this pica is the largest branch, which is going to supply the cerebellum. Okay. The remaining are the meningeal branches and the medullary branches. So the important and the largest branch is the posterior inferior cerebellar artery. We call it as pica. Okay, it's going to supply the cerebellum. The next artery is the basilar artery. So vertebral artery is over. The next is basilar artery. So you know how the basilar artery is formed, isn't it? The two vertebral arteries unite to form the basilar artery. So in this picture you can make out this is the base of the brain, and in the base of the brain you can see the arterial system. Okay, and just locate the vertebral arteries. So in front of the medulla, so you know the brainstem structures, isn't it? Medulla, pons and the midbrain. So in front of the medulla, the vertebral artery ascends, and just at the junction of pons and the medulla, the pontomedullary junction, the two vertebral artery unites to form the basilar artery. So now we are going to see about this basilar artery. So this basilar artery is present on the anterior surface of the pons. So in the pons, on the anterior surface, you have got a sulcus known as basilar sulcus, where this basilar artery is lodged. Okay. So this is the formation of the basilar artery, and this basilar artery terminates into two branches, the terminal branches. We call it as posterior cerebral artery. Yeah, posterior cerebral artery, that is the terminal branch of the basilar artery. What are its other branches? So the other branch is the first branch is the anterior inferior cerebellar artery. Okay, you can make out the anterior inferior cerebellar artery, which is going to supply the cerebellum. Whereas the posterior inferior cerebellar artery is a branch of vertebral artery. Whereas anterior inferior cerebellar artery is a branch of basilar artery. Then you have got a large artery, we call it as labyrinthine artery, which is going to supply the inner ear. They didn't show in this picture. There is another artery known as labyrinthine artery, which is going to supply the inner ear. Then you have got small branches. Can you make out small branches? These are the pontine branches, which are going to supply the pons. Yes. Then before terminating, it is giving another branch known as superior cerebellar artery. They have marked superior cerebellar artery. So these are the branches of the basilar artery. Again, I am coming back. So this basilar artery gives the first branch. It's the anterior inferior cerebellar artery, which is going to supply the cerebellum. The next is the largest branch, that is the labyrinthine artery, which is going to supply the inner ear. Then you have got short branches. So these are the pontine branches, which is going to supply the pons. Then this basilar artery, before terminating, it is giving another branch known as superior cerebellar artery, which is again going to supply the cerebellum. Then the terminal branch is the posterior cerebral artery. So these are the branches of the basilar artery. Yes, in this picture the branches are very clear. Here you can see the two vertebral arteries uniting to form the basilar artery, and from the basilar artery you can see the first branch. This is the post anterior inferior cerebellar artery, then small pontine branches, then the superior cerebellar artery and the posterior cerebral artery. Okay, and in this picture you can make out the large branch of the basilar artery, that is the labyrinthine artery, which is going to supply the inner ear. Labyrinthine artery, here they have shown in this picture. It's clear, the labyrinthine artery, that is one of the largest branch of the basilar artery, and it's very important branch also because it is going to supply the inner ear. Clear? Yes, this is about the basilar artery. So we have completed the vertebral artery and the basilar artery. So we have completed the vertebral system. Now we are moving on to the carotid system, which consists of two internal carotid arteries. Okay. Now we are going to see about the internal carotid artery. So in this picture, you can make out, yes, so this is the common carotid artery. Okay, and which is the branch of the brachiocephalic trunk. Yes, this common carotid artery divides into two branches. That is the external carotid artery, where I am showing in the pointer. This is the external carotid, and this is the larger deep branch, the internal carotid artery. So this internal carotid artery doesn't give any branches in the neck, though it is taking origin in the region of neck. It doesn't give any branches in the head, neck. It directly enters into the cranial cavity. So this internal carotid artery travels upwards and posteriorly very deeply, and it enters into the skull, the cranial cavity, through a foramen here. We call that foramen as, or canal, the carotid canal. So it enters the cranial cavity through a canal known as carotid canal. So in this slide, you can see the skull, base of the skull, where you can make out the carotid canal. So for the to show the carotid canal only, I have kept this slide. Okay. So they have marked the carotid canal. Yes. So through this carotid canal only, the internal carotid artery enters into the cranial cavity. So this is the base of the brain. This picture shows the base of the brain. Base of the skull. And this picture is the cavity of the skull, cranial cavity. Okay. So it enters through the carotid canal, then it enters into the cranial cavity, and here you can see the internal carotid artery. Yes, it comes out through foramen lacerum. It enters via the carotid canal and leaves out through foramen lacerum. There is a foramen known as foramen lacerum. So it leaves out through the foramen lacerum. Then what happens? It travels along the cavernous sinus. So here you can make out the cavernous sinus. Yes. So it travels along the cavernous sinus. Then it divides into various branches. So in this picture, you can make out the internal carotid artery. They have marked, isn't it? So this is the internal carotid artery and the branches. So the first branch which you are seeing here is the ophthalmic artery. Okay, this is the first branch of the internal carotid artery, the ophthalmic artery, and there is one more branch, the anterior choroidal artery, which is not seen here. I'll show in the next picture. Anterior choroidal artery. Then the terminal branch of the internal carotid artery is anterior cerebral artery and the middle cerebral artery. the middle cerebral artery, we can even call it as continuation of the internal carotid artery. Okay, so the terminal branch of the internal carotid artery is anterior cerebral artery and the middle cerebral artery. Okay, I will talk about the circle of Willis later. Now just concentrate on the branches of the internal carotid artery. So this is again the branches of the internal carotid artery. So this is the internal carotid artery. You can see the ophthalmic branch, and here they have shown the anterior choroidal artery. In this picture, the anterior choroidal artery is clear. Then the terminal branch, the anterior cerebral artery and the middle cerebral artery. This middle cerebral artery is very, very important artery. Okay. So these are the branches of the internal carotid artery. Now we are going to see in detail about the branches of the internal carotid artery. Okay. So in this picture, can you make out the internal carotid artery? Where is it? Yes. See, this is the internal carotid artery. You can see its first branch, the ophthalmic artery. So this ophthalmic artery enters into optic canal, okay, along with the optic nerve. So along with the optic nerve, this ophthalmic artery enters into the optic canal and supplies the contents of the orbit. So this picture is the orbit picture. Okay, here you can see its branches which is supplying the contents of the orbit. So the next artery which we are going to see is anterior choroidal artery. Okay, so this artery is very, very thin. Its lumen is very, very thin. Here this is the internal. In this picture, can you locate the internal carotid artery? This is the internal carotid artery, and you can see a very thin branch, the anterior choroidal artery. Yes, yes. So this is the anterior choroidal artery. Its lumen is very, very thin, but it has got a long subarachnoid course. Okay, so why it is subarachnoid course? The entire arterial system, these entire arteries are present in which space? In the subarachnoid space. Beneath the arachnoid matter, there is a space known as subarachnoid space. This arterial system is present in that subarachnoid space. Okay, so this anterior choroidal artery, it has got a long course, but it's very, very thin, so it likely to get thrombosed often. So we call this artery as artery of cerebral thrombosis, anterior choroidal artery. Next artery is the middle cerebral artery, which is very important artery, and as I said, it is a continuation of internal carotid artery. Yes, this is the internal carotid artery and this is the middle cerebral artery. So this is the middle cerebral artery, okay, which is the terminal branch of the internal carotid artery. This middle cerebral artery will enter into the lateral sulcus of the brain. So there are many sulcus, isn't it? Yes, one among the sulcus is the lateral sulcus. This middle cerebral artery, from the base of the brain, it enters into the lateral sulcus of the brain. Yes. So in this picture, we have shown the lateral sulcus. Okay. So yes. So this is the lateral sulcus. So here you can see the artery running. This is the middle cerebral artery. Runs along the lateral sulcus and divides into its terminal branches, which is going to supply the parietal lobe, the temporal lobe. Okay, so those are the terminal branches of the middle cerebral artery, which is the largest branch and very important branch, which is running in the lateral sulcus. So this picture is the cut section of the brain, the coronal section of the brain, and here you can make out the internal carotid artery. Yes, so this is the internal carotid artery. It is giving its terminal branches, the middle cerebral artery and the anterior cerebral artery. This middle cerebral artery is running along the lateral sulcus. Here, this picture mainly shows the branches of the middle cerebral artery in detail. Okay, here you can make out the important branch of the middle cerebral artery, that is the lenticulostriate artery, which is going to supply the lenticular nucleus of the corpus striatum. So this is the lenticular nucleus, this is the caudate nucleus of the corpus striatum, and the other branches also supplies the caudate nucleus. So all the components of the corpus striatum is supplied by this lenticulostriate arteries. It's very important artery, and it also supplies the internal capsule. So they have marked the internal capsule also. So this is the internal capsule, this is the caudate nucleus, and here will be the lentiform nucleus. Okay, so this middle cerebral artery supplies all these structures, so it's very, very important. And finally, it is dividing into superior division and the inferior division. Next artery is the anterior cerebral artery. Okay. So that is the one of the terminal branch of the internal carotid artery. So after taking origin from the internal carotid artery, this anterior cerebral artery will enter into median longitudinal fissure. Okay. It enters into the medial longitudinal fissure and supplies the frontal lobe. It mainly supplies the frontal lobe. Yes. So in this picture you can make out the anterior cerebral artery. Yes. And this anterior cerebral artery will be winding around the callosal sulcus, around the corpus callosum. So this is the structure you will be familiar by now, that is the corpus callosum. So around the corpus callosum there is a sulcus known as callosal sulcus. This anterior cerebral artery will be lodged in this callosal sulcus. It is one of the spotter also. They will just pin in the callosal sulcus and they will ask what is the structure lodged in the callosal sulcus. It is the anterior cerebral artery. Okay, and they even pin in the lateral sulcus and they can ask structure lodged in the lateral sulcus. That is nothing but the middle cerebral artery. So this picture shows the base of the brain with the artery supplying the brain. Here you can make out the internal carotid artery and its terminal branches, and this picture mainly I took to show you the anterior cerebral artery, which is taking origin from the internal carotid artery, and how it's going into the median longitudinal fissure. So this is the median longitudinal fissure. So it is entering into the median longitudinal fissure and supplying the entire frontal lobe. Yes. So the sagittal section picture we have seen it. So till now we have completed the vertebral system as well as internal carotid system. That is the vertebral artery and its branches, internal carotid artery and its branches we have completed. Now these two systems are connected. These two systems are connected by some communicating arteries and forms a circle that is known as circle of Willis. Okay. So now where the circle of Willis is exactly present? So it is present in interpeduncular fossa. So what is this interpeduncular fossa? So this region where I am showing in the pointer, this is the interpeduncular fossa. So within this region only the circle of Willis is present. This picture shows the circle. Can you make out the arterial circle? So this is the circle of Willis. Now we will see the formation, how this circle, how this vertebral arteries and the internal carotid arteries has been connected. And now, yes, now we are going to see about the formation of this circle of Willis. So already you know there are two arteries, the vertebral artery and the internal carotid artery. So this is the internal carotid artery, which is dividing into anterior cerebral and the middle cerebral. So there are two anterior cerebral arteries, and these two anterior cerebral artery has been united by a communicating artery known as anterior communicating artery, which communicates the two anterior cerebral artery. Okay, and this internal carotid artery and the terminal branch of the basilar artery. Yes, this is the terminal branch of the basilar artery, has been connected by another communicating artery known as posterior communicating artery, which is a branch of the internal carotid artery. Before, I didn't tell about this branch. Now I am telling. The posterior communicating artery is also a branch of the internal carotid artery. Okay, so it arises from the internal carotid artery and communicates with the basilar artery, the terminal branch, that is the posterior cerebral artery. Okay, so this posterior communicating artery communicates the internal carotid artery as well as the posterior cerebral artery. So by these two communicating arteries, the vertebral artery, the vertebral system and the carotid system has been communicated and forming a circle known as circle of Willis. So by formation of the circle of Willis, the entire brain is getting its arterial supply through its branches. Okay. So the functional significance, one peculiar feature is, though it is communicated, the vertebral system and the internal carotid system, though it is communicated, its bloodstream is different. Okay, so there is little or no mixing of bloodstream between the vertebral and the internal carotid arteries. Therefore, the right half of the brain is supplied by right vertebral and the right internal carotid, whereas left half is supplied by the left vertebral and the left internal carotid artery. Next, we are going to see about the arterial supply of cerebrum. So till now, as a whole, what are the arteries supplying and how those arteries are connected, we have seen. Now, individually, what are the arteries supplying the cerebrum, what are the arteries supplying the cerebellum, the brainstem structures, we will see in detail. So coming to the arterial supply of cerebrum, this cerebrum has got three surfaces. One is the superolateral surface, then the medial surface and the inferior surface. So what are the arteries supplying the superolateral surface? So in this picture, you can make out three shades. They have given three shades. One is blue, pink and the green. Pink denotes middle cerebral artery, blue is for the anterior cerebral artery and the green is for the posterior cerebral artery. As I said already, this middle cerebral artery will be running along the lateral surface. So it supplies the parietal and the temporal. Okay, mostly the parietal and the temporal. So you can make out the shading. So most of the surface of the superolateral surface of the cerebrum is supplied by the middle cerebral artery. A small strip along the superomedial border up to the parieto-occipital sulcus. So which is parieto-occipital sulcus? Yes, this is the parieto-occipital sulcus. So up to the parieto-occipital sulcus, along the superomedial border, the anterior cerebral artery supplies. Okay. Then the occipital lobe as well as the inferior part of the temporal lobe is supplied by the posterior cerebral artery. Okay. So you can make out. So most of the superolateral surface of the cerebrum is supplied by the middle cerebral artery. Next is the medial surface. So again the three color codings, the same color coding. Blue is for the anterior cerebral, pink is for the middle cerebral and the green is for the posterior cerebral. So you can make out most of the medial surface is supplied by the anterior cerebral artery. A smaller portion in the temporal lobe, that is the temporal pole, is supplied by the middle cerebral artery, whereas the remaining part of the temporal lobe as well as the occipital lobe is supplied by the posterior cerebral artery, whereas remaining the frontal, parietal, all are supplied by the anterior cerebral artery. So medial surface is dominated. The last surface is the inferior surface. So inferior surface is the picture showing the inferior surface of the brain. Again the three color codings, blue is for the, but here the blue is for posterior cerebral and the green is for middle cerebral and the purple is for the anterior cerebral. The color coding is different here. So most of the inferior surface is supplied by the posterior cerebral artery. A minor portion is by the middle cerebral and a small strip by the anterior cerebral artery. So in this picture you can make out the circle of Willis. Here's the cadaveric picture. You can make out the two vertebral arteries. So this is the two vertebral arteries uniting at the pontomedullary junction to form the basilar artery. This basilar artery is running along the anterior surface of the pons, which is dividing into posterior cerebral artery. Okay. So you can make out the posterior cerebral artery is communicated with the internal carotid artery through the posterior communicating artery. Okay, you can see the large internal carotid artery. Is the anterior cerebral? It's very thin. In this picture, it's not that clear. Okay. And you can see the branches of basilar arteries. Yes. So with this, we are completing the arterial supply of the brain. The venous drainage will be dealt in the next video. Thank you.